The number one reason for failure is poor planning, poor prosthetic planning on the part of the dentist, making sure you review their medical history, you understand functionality of the patients are, what their expectations are. You really want to find somebody who has some experience under their belt. Anybody can drill a hole and put a stud there, but obviously you're going to want to make sure that you have somebody that has a lot of experience, is comfortable working with patients to satisfy those needs and those expectations, but particularly an implant dentist, somebody who has credentials, who has the fundamental training behind the knowledge and the experience to go with it. I'm a restorative dentist, but I'm also an implant dentist. There's a lot of difference between somebody who works in general dentistry and then refers out for those cases for the surgery. And sometimes there's a little disconnect there. Obviously, your comfort level as a patient, you're working with 2 or 3 different specialists or doctors. And, it's a little bit stressful doing that. But also, the general dentists lose a lot of control over the final product. Being a restorative dentist and somebody who does their own surgery, there's a huge benefit to that because you have full control over the outcome. And personally, I'd like to have full control. I like to make sure that my patients are happy, but also that I'm happy. The burden rests solely on my shoulders, and I'm okay with that because I want to make sure that everything is done properly, everything's done right, and the patient's happy with the final outcome. We have 2 technologies in our office that really provide an amazing diagnostic tool for us. We have the 3D X-ray, the cone beam CT scan, and we also have an iTero, which is a intraoral 3D camera that essentially we can use those 2 technologies to provide the best success rates for placement of implants. And we use those technologies together to create a surgical guide so that it is very predictable, the results. It's also less discomfort, less stress for the patient. When the surgery goes smoothly, it's less stressful for the doctor because we don't have to think so much. We've done all the thinking ahead of time, planning ahead of time. So the patient's happy, we're happy, and the results are much, much better. Having those technology is paramount for us.